Outpatient joint replacement sounds fast, convenient, and almost too good to be true. So the real question isn't whether it's possible, the real question is whether it's actually safe or if it's just the latest trend being pushed a little too hard. I'm Dr. Donald Hope, an orthopedic surgeon specializing in hip and knee replacement surgery, and I see patients every week who are confused by this idea. Some are excited by the idea and promise of going home the same day. Others are worried they're being rushed out the door before they're ready. And that confusion matters because the wrong expectations can lead to unnecessary fear, poor recovery, or the wrong decision for the wrong patient. By the end of this, you'll understand who outpatient joint replacement is truly designed for, who it's not appropriate for, and how same-day discharge actually compares to a short hospital stay, and what has to be in place at home for this to work safely. Let's start with the biggest misconception. Many people think outpatient joint replacement means you're having a lighter surgery, that something is being skipped or done differently. In reality, the operation itself is exactly the same. The implant is the same, the surgical precision is the same. What's different is the system built around the patient. The first and most important factor is who the patient is. Outpatient joint replacement works best for patients who are medically stable, relatively healthy, and motivated. That usually means no uncontrolled heart or lung disease, no severe sleep apnea that isn't treated, and no major issues with balance or mobility before the surgery. Age alone isn't the deciding factor. I've seen very active patients in their 70s or 80s do extremely well, and younger patients with complex medical issues who are not good candidates for same-day discharge. The next piece people often misunderstand is the difference between same-day discharge and a short hospital stay. Going home the same day doesn't mean being wheeled out an hour after surgery. It means you recovered in a monitored setting, work with physical therapy, control pain, and meet very specific safety milestones before leaving. A 23-hour stay simply adds an overnight observation period. From a recovery standpoint, outcomes between the two are often very similar when the right patient is chosen. The decision usually comes down to comfort level, medical history, and logistics at home. Pain control is another area where outdated ideas cause unnecessary fear. Patients may still picture a joint replacement as weeks of severe pain managed only with strong narcotics, but modern pain protocols are completely different. We use a layered approach that combines regional anesthesia, anti-inflammatory medications, nerve targeting techniques, and minimal opioids. The goal isn't to eliminate all sensation, it's to keep pain controlled enough that you can move safely, sleep, and start recovery immediately. Here's where the conversation really shifts. Outpatient joint replacement isn't about getting you out of the hospital faster, it's about getting you back to your normal environment sooner. For the right patient, being at home reduces stress, improves sleep, lowers infection risk, and often leads to a smoother recovery. But that only works if the home environment is prepared. Patients who succeed with outpatient surgery have support, someone to help for the first few days after the surgery, a safe place to walk, sit, and sleep, a clear understanding of the medications, the exercises, and the warning signs. When those pieces are missing, even the best surgery can feel overwhelming. The big takeaway is this: outpatient joint replacement is not a shortcut, and it's not something to chase just because it sounds modern. It's a tool. When used for the right patient with the right preparation, it can be incredibly safe and effective. When forced on the wrong patient, it can create unnecessary stress and setbacks. If you're researching joint replacement and hearing different opinions, that's normal. The right plan is always individualized. Ask questions, understand your risks, and focus less on how fast you go home and more on how well you recover in the weeks and months that follow. That's really where the success is defined.